no cost to you, and just want to make sure that you are aware and that you can take advantage of these programs. So as I mentioned, we call it our Agent Toolkit, and I just want to go through some of the features that we have within our toolkit. And then at the end, there will be some contact information that you can reach out to either myself or one of the other sales directors or anyone on the service team. And if you're interested in any of these programs, we can go ahead and get you signed up for it. And as I mentioned, many of these are available at no cost to you. Just a quick housekeeping notes here. So everyone's phones are muted. And if you have a question as I'm going through, there is a chat box. If you can just click into the chat, type your question in, and I'll be happy to answer those as we go along. And then at the very end, this presentation is being recorded. So at the end, if you're interested in getting a copy of this, we can send this out to you. This will also be posted out on our website as well. So when I mentioned to you like Agent Toolkit, really we're looking at, you know, what are you using today to generate business? We put a lot of strategic and thought into what we can offer to our agents, what we have seen that's worked in the past, and what other tools can we offer to you to help you sell compliantly and also get in front of those individuals either turning 65 or looking for Medicare each year, you know, during AEP. So some of the tools that we have available, again, is first and foremost, we have a couple quoting and enrollment tools. One is the CSG Medicare quoting tool. The nice thing with the CSG quoting tool, it's MedSup, MedAdvantage, final expense, dental, and also a hospital indemnity. And it's set up to show plans available all across the country. So even if you're just selling in Ohio and you have a client moving out of state, you can still use the tool to see what would be available for your client in another state. We also have Medicare Center Enrollment Tool. What this has been heavily utilized by a lot of our agents. This again is a tool. It's no cost to you. It's for Medicare Advantage and prescription drug enrollment and quoting capability. And I'll get into this a little bit more in detail. We also have discount mailer programs, again, to just additional lead generations. We also have co-op available as well. So as you're looking to do some different events, whether it's marketing, sales events, educational events, even advertising in a newspaper, reach out to us because we would like to help and partner with you on helping share some of those expenses with you. We also have a mailing list that if you're looking to do any type of seminars or just looking for your own type of mailer, we can provide you a list of any demographics that you're looking for. We have a T65 app. Again, I'll get into a little bit more detail on that. That's another way to generate free leads. And then we have a broker-centric tool, which is a repository of information. You have access to 24/7. And then we have another new feature, which is social media and website marketing. And as I mentioned, I'll get into the details in these next few slides. First and foremost, I mentioned about the CSG tool. Again, this is a free tool that you would go out to cornerstoneseniormarketing.com, and under resources, you would click CSG. If you're not already set up with the tool, you can actually request access, and then we can give you permission. As long as you're doing business with Cornerstone, you will get this automatically. We will go in and approve you. And some of the features that you'll be able to use with this, again, is you can quote and compare plans for Medicare Advantage, Medicare Supplement, dental, final expense, and hospital indemnity. And it's also a great tool to use when you are, for filling in the gaps for, if you want to looking to add some ancillary benefits like a hospital indemnity. And at the end of the presentation, I'll go through and show you how to enroll in these plans or enroll into this program. And then in addition, I'll show you some of the features how easy it is really to use. The nice thing about this tool as well is it's very professional looking in the sense that you can quote and compare plans side by side. And then when you print that off or save it to a PDF and email it to your client, it's actually posted on a letterhead that is created within the system. and you'll be able to go in, put your contact information in. If you have a logo, you can put your logo in there, or you can put a picture yourself. And when you print the quote out, it actually shows like it's on your own letterhead. Very professional and very easy to use. And as I mentioned earlier, all carriers within all states, and it's not just carriers you have with Cornerstone Senior Marketing. And I'll show you again a little bit later on exactly how that you can use to your advantage, because it's a great tool. If you are quoting against a carrier you're not familiar with, you can go in and look at market analytics, and you can see just how competitive that plan is, rate increase history, and any other information that you're looking to do. I mentioned earlier about fill in the blanks with the hospital indemnity. You literally can, if you're selling, you already know what plan you're selling for Medicare Advantage, you can go ahead and display that plan on one side of the screen. Then you can click and fill in the gaps, and then you can put a hospital indemnity plan right next to your Medicare Advantage plan, and you literally can go line by line and show how you show your client how you can reduce or eliminate those co-pays that they would be paying. So, for example, if they're paying $350 a day, days 1 through 5, if that's a concern to your client and they're not, don't have that kind of money laying around and they're looking to either eliminate that or reduce it, you can put the hospital indemnity plan, and you can select up to $350 a day to cover those days 1 through 5. There are we actually have an app for this as well, so you can put it on your iPhone or your iPad, and if you're away from your office, you can actually pull up the quoting tool from your phone or your iPad, and you can run and do the same stuff as what you're seeing, what you would see on your desktop. And then they are continuing looking to improve the functionality of the tool. Today they have Medicare supplement enrollments. I know a couple of carriers that we use, Aetna and Aetna and Mutual of Omaha. Those applications are set up out there, so you can actually do an enrollment for Medicare supplement on the CSG tool. They are looking to add Medicare online enrollments to this platform either later this year or into next year. The other tool which we have had, it's been a huge success with our agents, is the Medicare Center enrollment tool. And if you remember last year during open enrollment, when CMS on Medicare.gov, they did not allow you to no longer save your client's information, their prescription drugs, and just all their information out there. The only way you could do that was set up individual username and passwords for each one of your clients, and they're asking you not to hang on to that username and password. That would be for your client's use only, which, as you and I know, that is not really that efficient, because to ask you, senior, the following year, do you have your username and password, it's going to be difficult for them, a lot of them, to remember that information. And with everything that today, everything requires a username or password, it's difficult to even some of the sites you use more frequently to remember those passwords. So Medicare Center, it does have that functionality. You can go in and you can save all your clients' information, and you can also save that, and you don't need a username or password. And it's kind of like, it's got like a mini CRM built into the system. So as much information as you put in there is going to benefit you later down the road. But it does, you can do presentations and do enrollments compliantly and efficiently. We've had, as I mentioned, quite a few of our agents this past AEP. I think we had well over 5,000 enrollments done just through this tool, both on a PDP and Medicare Advantage side. It does also have the electronic scope of appointment as well. And again, I'll show you a quick demo on how this works, but it does allow you to do the scope of appointment, and it actually saves it in the system for you. You can also do comparison plans side by side with multiple carriers. And the most important thing, it is 100% free. I believe there are 17 carriers today that are out there. I listed some of the major carriers that are showing up today in the system. The nice thing about this is it's a free tool. If you're doing business with Cornerstone already and you are ready to sell with any of the carriers I listed down below, or any of the other carriers that are set up in the system, you automatically have access to the tool. And I'll show you again a little bit later on how you would get access, and you can go out there and kind of test it and play around with it. Another program we introduced probably about 2 years ago now, is a discount mailer program. We had talked to a lot of our agents, and they were looking for ways to generate additional leads. And we formed this partnership with Target Leads to strictly offer a discount to our brokers. So if you are doing mailers today, the mailers will only cost you through Cornerstone 30 cents per mailer. And it would be $300 for a 1,000-piece mailer, and typically you're looking at close to 500 to, depending on the type of mailer you're looking, to over $500 for this. So we subsidize the rest. We do pay the difference for that. And the way the program works, if you are interested in Target Leads, just contact us. We will send you the name of our contact at Target Leads. We want you to work directly with them, because the nice thing with Target Leads is they will work with you to find out exactly what you're looking, who you're looking to target, whether it's low income or if it's just turning 65, or if you're looking to, whatever age group, 66, 67-year-olds. And then they have a whole catalog of mailers that they've used, and they can actually tell you their actual response rates on their mailers. So obviously they'll know, like, well, this mailer, when we used it in the past and we did not get much success, this is the one that's been responding 1.5 or 2%, which is pretty good for that, for those type of mailers. But when you contact Target Leads, you just let them know that you're a Cornerstone senior marketing broker. It'll come to us. We will approve it. They'll go ahead and work with you, put the entire mailer together, and then once we approve it, then you would just pay the 30 cents per mailer. And again, there's no limit on how many mailers you can do. Typically, most agents or brokers will start with a 1,000-piece mailer, so they're looking at a charge of $300. And if you write 2 Medicare Advantage sales from it, then you've already paid for your mailer, and then now you have a nice reoccurring income, on the renewal basis. We also have a direct leads discount. So part of being the benefit of being part of Integrity Marketing Group, we have a new partnership that has joined Integrity Marketing Group. They have a ton of leads, direct leads that they are not shared. These are exclusive leads, and we have partnered with them, and we're basically, what they're charging us is what we're going to charge you. And then I would encourage you to reach out to one of your sales directors to look, because we definitely could do some co-op dollars to help offset some of the expense. But typically our cost would be $22 or $23 a lead from them, which is significantly less than if you would go to any other direct mailer, or lead generation place. They're going to charge you in excess of $30 a lead. And again, this is a newer program. We have just launched this not too long ago. So again, we're looking for feedback as we go through this, but we definitely want to help you offset some of the expenses on this, and also help you generate some additional business. But these are guaranteed leads, exclusive to you. They do not share, do not sell these to anybody else. So it's a true exclusive lead. We also have free mailing lists. If you are looking to do any seminars, whether it's an educational or sales seminar, and you have a flyer that you've already created and you're looking to, who do I send this to? We have a sheet that you can complete and basically select the demographics that you're looking for, and we will generate up to 1,000 names to you based on the demographics you selected. And this is a great way. We've had agents in the past use this for their either their educational or sales events, and to get additional bodies there to listen to your presentation. And if you're looking to do any of your own personal mailers, again, this is another way to generate those names. And again, there's no cost to you at all. This is just some of the demographics that you can select. Now, obviously in Ohio, you cannot call or knock on any doors. So on the select criteria on the left there, it says do not call. We can actually scrub it, and if they've opted in, in for the do not call, those names will not show on there. But it does show all records with phone numbers as well and addresses. And then you can drill down as much or as little as you want, whether you can go by marital status, gender, if they own a home, different things like that. And if you're looking to do anything like that, just reach out to us. We can send you the form. You can select it. We can run the list. And depending on the responses, we may ask you to maybe not check so many filters, and we can get you more names. Other times, depending on the area you're looking at, if you drill down deeper, you can get more quality leads that you're looking for to mail to. We have a T65 locator app, and with Integrity, we have a few proprietary med sub products and ancillary products that we offer. These were created through Integrity. Three of the med sub carriers, Lumico, Union Security, and Central States Indemnity. And if you're out on the running any quotes like on CSG and you look at them, especially the Lumico and Union Security, these are the top 3 to 5 carriers listed in terms of least expensive price. We also have SureBridge, which is a dental vision hearing. They also have a hospital indemnity as well. And this is a United Healthcare product. And if you do contract with any of these carriers, we do set you up with a T65 location app. The nice thing about this is if you are out at a client's house, when you're done with the appointment, you go out to your car, you can actually click in the T65 location app. It will show you up to 10 names in that area that are turning 65. And what I would recommend is either take a screenshot from your phone or write the individual's names and addresses down. Now, again, in Ohio, you're not allowed to knock on the door or give them a call, but what you can do, which will really, I think, set you apart from everyone else, is do a handwritten letter to those individuals turning 65 and put your business card in there. As you know, when someone's turning 65, they're inundated with all kinds of mails from carriers, for other brokers, and different things like that, and they just see some big stack. But if you take the time to do a little personal note, and again, it would show you 10 at a time, wouldn't take much time to do that, that's definitely going to get their attention. They're definitely going to at least open it and take a look at that. Again, this is available free as long as you contract with one of the proprietary products. We have another tool. It's called Broker Centric, and we are making updates to this as we speak. But it is a online repository that offers direct 24/7 access to guides, like app and appointment form submissions, enrollment period, frequently asked questions, carrier processes. It's a whole library of information. We also put any of our recorded webinars out there as well. We are working as we speak on adding this feature to our website. So today, if you want access to this, you would need a username and a password to gain access to it. You would just let us know you want access, and we can get you set up. But what will happen in the future, in the very near future, in the next coming months, you will see that on our website without a username or password, and you can go out. Even if you're looking at something late at night, you can go out to our website and have access to that information, again, 24/7. One of the newest features we've added to our website in our agent toolkit is it's social media. And we've got a partnership set up with Snoozy. And the nice thing about this company is this guy only works with insurance agents. He understands insurance. He understands how to market compliantly. So we feel comfortable with what he is doing in terms of helping you generate additional business. The nice thing about this is it just kind of give you some demographics on the type of the age of individuals using Facebook, for example. The stats say around 7 in 10 U.S. adults, 69% use Facebook. 62% of those are online seniors aged 65 and over. and 72% are between age 50 and 64. So this is the exact market that you're trying to target with, and with this social media services, they will go out and post different articles to get your name out there in front of those individuals. The way it's set up, and we actually have some upcoming webinars regarding this as well. One of Ken over at Snoozy, one of the things he pushes is it's not so much putting content out there, but is actually directing you or driving that individual to a place. So he does stress the importance of having a website. If you do not have a website, he can also set that up. You can see the pricing on the screen. If you're looking just for the social media content posting, it's $49.99 per month. It's about a 20% savings, 20 to 25% off. That savings. It is a month-to-month service. So if you try it 1 month and you're not happy, you can cancel it at any time. You're not obligated for a full year or any long-term contract. And if you don't have a website and you're looking to have one built, he will build one of those for you and they charge $59.99 per month for that. The nice thing about this is, and I've not seen this anywhere else, is there is no charge for any setup fee. So he will set this up, and it is a month-to-month contract. So if you get it done, say for this month, and then next month you decide, or a couple months down the road, you decide, I don't like the website, I'm not happy with it, or you can cancel that at any time. You don't have to keep a long-term contract with that. And then he also has a special where you can bundle both, and this is what he's encouraging, is for $99.99 a month, he can set up a website and then also do the social media. And when there's social media posts, he's actually going to drive them to your website so they can see all the services that you do offer. And you can put some of the quoting tools out there as well, like the Medicare Center and things like that too for individuals. Or if you're selling standalone dental, you can put a standalone dental link out there. I know a lot of the carriers have that, and they can actually do the enrollment on your website online without you being there for that. So to sign up for the website, you would go to Cornerstone Senior Marketing. You sign that up online, and then you would just fill in the information, and then it would come back to us for approval. We are looking for at least 2 major carriers done with Cornerstone because it is being offset by Cornerstone. And then you would work directly with Ken and his team to actually set everything up. He likes to, when you first fill this in, he likes to set up a consultation to find out exactly what you're looking for so he can build something and really guide you in what's going to work best and what he sees and things like that. Of course, we do our annual roadshow every year, and this year it will be starting in Cincinnati, Toledo, Cleveland, then Columbus, and the dates are August the 24th through the 27th. If you're not familiar with our roadshow, we do bring in all the carriers, and that's where you can go at one location and you can see all the carriers, their first looks in terms of what are they going to be offering for this upcoming open enrollment. So instead of going to 10 different meetings or 8 different meetings, depending on how many carriers you're contracted with, you can show up for one day at our roadshow. You can listen in on all the carriers, what they have to offer, and then kind of put your game plan together in terms of what you need to do with your existing clients and any new clients, and find out what exactly is going to be competitive for the upcoming year. There'll be more information coming out on that, but wanted to let you know that this is, again, this is an annual thing we do, and the dates are August the 24th through the 27th, and it will be reviewing the plans for plan year 2021. So here, I just want to kind of go through some of the context here. When you look at our total years of service, we're well over 100 years combined between our sales and service team. Very well experienced and very knowledgeable in the senior market. So here are the sales directors we have today. Again, I'm Paul McMillan. He's our national director. He's out of our Columbus office. Jamie LeBron is in Northeast Ohio. Michelle Cap. She works with all of our proprietary products. We have hired a new person in Northwest Ohio. She will be starting on Monday. Look for an announcement to go out in the next day or two in terms of her contact information. But we have a new Toledo office up there, and this person is very knowledgeable. Been in the, but actually been on the as an agent selling insurance, and then also worked for Cornerstone as well. Here is a list of our service team, so you can also reach out to any of your service team members. They have information on this as well. Matt Fry is the service manager. He handles basically all the operations and manages the service team. And then each of the individuals, Jim, Lila, Patrick, and Lisa, are all split out by alpha split. So based on the agent's last name, that would be who your service rep is. Their email, and this is anyone's email at Cornerstone Senior Marketing, is their first name dot their last name at cornerstoneseniormarketing.com. And then I wanted to show you here as well the rest of our support team. Kelly Myers, she works with all of our sub-GA partnerships that we have, and she's handles all their service and support for those guys. Sarah handles all of our licensing and contracting. Maria is our commissions, so if there's any commission issues, you can reach out to Maria. And then we have Danielle and Marilyn that Marilyn helps out a lot with marketing pieces and things like that. And Danielle is also there for support as well. And again, it's their first name dot last name at cornerstoneseniormarketing.com. And our website, all the tools that we spoke about or I spoke about is located on our website, cornerstoneseniormarketing.com. And what I'd like to do, if there's no questions, is I'm going to take you through both the CSG quoting tool and then the Medicare Center. This is just going to be a high-level overview. We would welcome the opportunity to speak with you one-on-one and go through the actual training on how to use this, because both tools are heavily utilized by all of our agents. And if you're not using it, then it's something I think you're missing out on, and it could really help you both from an efficient standpoint and also from a knowledge standpoint from a competitive view. So let me try. I'm going to get out of this presentation here, and you should be able to, everyone should be able to see my screen. This is the Cornerstone website. Again, just cornerstoneseniormarketing.com. When you first go to the site, there was a box that it will pop up and will ask you if you want to subscribe to our newsletters. If you're not getting any of our newsletters at all, I would encourage you to complete that. This will give you any information on any carrier updates that we send out. We do a weekly newsletter as well if it highlights anything that of importance that we ran across during the week, and also just information on some upcoming webinars. We have webinars scheduled pretty much one every week, and again, this is information I think that you would you can pick and choose obviously which ones you want to sit in, but there's some great information and some great webinars coming up. So to go to, I'm going to show you our CSG quoting tool first. To get there, you're going to go to under resources, you're going to click on CSG Medicare quoting tool. I'm already logged in here, but what will happen is if you're, let me sign out here for a second. When you go to Cornerstone Senior Marketing and you click on CSG quoting tool, this will pop up, and this is the username and password, and then you click sign in. If you do not have an account with CSG today or through us, you're just going to click request account, and when you click on request account, you'll put your first, your last name in, and then your email address, and then below that, since my email address is already set up in the system, below that you can actually type in what your password is, and you would have to type it in twice to verify that it's the same. You've got the exact password matches. But once that is completed, you click submit. That goes over to Danielle and Marilyn, and they will again, as long as you're doing business with Cornerstone, then you will get approved for it. Let me go back to the login page, and then once you get your username and password. You just type that in and click sign in. And then, as I mentioned, you can do Medicare Supplement, Medicare Advantage, Final Expense, Hospital Indemnity, and Dental. And then if you're looking to do an online application, then you can do that here under e-applications. The first thing I always tell an agent when you sign up for the CSG tool is to go over to My Account, click into there. This is where you can customize and make this. This is what's going to show up on the letterhead when you print off or you email a quote to a prospective client. It will have your first, last name. You can put your phone number in there. The username is going to be your email address, and then this is where you can change your password if you're not happy with the password that you have. Under Portrait, this will be blank. You can click Browse, and you can actually select if it's a picture of yourself or your company logo. This is where you can upload that and put that in the system. And then if you have an agency name, you can put that there and along with your website. Once that's done, just click Save, and then you are good to go. And then we're going to go back to the dashboard. I'm just going to run through a couple of highlights on this to show you how valuable and how you really can benefit by using this tool. So first thing we'll do is run a Medicare supplement quote. And as I mentioned, this is available in all 50 states. So it's not just the carriers that you're running through Cornerstone. This is going to show every carrier that is available. We're going to click Run Quote. We're going to type in a zip code. It will automatically populate the county. You can put in the age of the individual. I'm not sure why this is not populating. The county will populate here. If there's multiple counties, you can show both counties, or you can go down and you can select the exact county. The age, the gender, smoker, non-smoker, you can put in the plan that you're looking for. It's going to sort by price, but you can also sort by AM Best rating, S&P rating, or company name. It always defaults to price, and it kind of just shows you, because the plans are standardized, this will show you what are the least expensive, most competitive plans. I always recommend, it's optional, is to put the client's name in there. So if you are running a quote and then you want to email that quote, the client's name will show up on that quote. If you don't put any name on there or fill in anything in this blank here, then it's not going to show anything other than just the quote and your contact information. But we can just put in there test client. The other feature is there's a show advanced, and the nice thing with this is if you click on show advanced, you can put in health conditions, and it will populate any of the carriers that would most likely take somebody with those type of conditions. So instead of trying to submit something to a carrier and waiting for a declination or an acceptance, if you're not sure, you can always go out. You can, you can, whatever condition, you can type it in, or you can scroll down and put in a condition. And then you can also put in prescription drugs as well. And again, conditions, and then the prescriptions is a lot of the unknown. You're not sure if somebody's on a certain prescription, if they would be taken or not. Once you select a prescription, and I'll just check one here, then you can put an associated condition with that. You just want to click Add Filter, and then it will show you the medication entry, and do the same thing on the health conditions, and then you can click Get Quote. And then this will show any carrier that would more than likely take somebody with that condition. If you're not going to see that carrier, then obviously it's not going to be a fit with that condition. It pops up and it does tell you about the e-applications because it is available. So not only can you quote, but then if you're writing either the Continental Life, which is the Aetna product, or the Mutual of Omaha, you can do the enrollment through the e-application there. So you can see these are the carriers based on the, it tells you here with the health condition and or medications, these are carriers that would accept that. So I mentioned Lumico earlier. This is one of the Integrity proprietary products. It is extremely competitive, and you can see it's showing up #2 on a Plan G for a 65-year-old female. But as you scroll down, you can see it's going from least expensive to most expensive. You can also filter things over here as well. So you notice some of the plans will show a household discount if they have one or not. Others do not. If you want, you can apply the household discount. Hang on a second here. It would actually show. Bear with me 1 second. I'm not sure why it's. If you click on household discount, it would show you the least expensive when you apply the household discount. The other feature which I love about this is the market analytics. And this is really where you can use to sell against some of the carriers out there. So whether it's a carrier that does not use agents, or they're just strictly using, a call center, or if it's a competitor, a plan that does use agents, but it's, you can actually get the information about the plan, and then you can use that in your sales presentation. But if you click on market analytics, it's going to show you with each carrier, again, it's going to show you the monthly premium, and that at each age, 66, 67, 68, and 69, it's going to show you how much of an increase it would take each year if they did not take any plan rate increases at all. It also shows you the increase history as well. So this one is not showing a plan increase because they've not taken one yet. If you look at over here to the right, it tells you how many years they've been in the market. And this is probably a newer plan that they may have shut a block off and started a new plan because it's effective 6/1/2019. You can see how many lives they have, the total premium dollars, their overall loss ratio, and their how much market penetration they have. And this is through 2018. Again, here's Lumico. They I know last year took a 3% rate increase, but again, this is where I think you can, show them it's like age 66, it's going to stay the same. Age 67 is going to stay the same. So if they take any increase, that's all you're looking at. You're not looking at necessarily a rate increase on top of an age band increase as well. But it shows you for, again, every carrier that is marketed, it's been approved by ODI to sell in Ohio. So you can just scroll down, you can see all the different plans. But again, it's a great feature just from the market analytics standpoint, to show exactly from a carrier standpoint how stable they are. Because obviously, the last thing you want to do is put it with one carrier and not have to want to keep it there and not have to rewrite that year after year, if you can even rewrite it based on underwriting. So again, these are just some of the highlights that you can use. I'm going to go back to the dashboard because I do want to show you the Medicare Advantage side of things as well. We're going to run a quote for Medicare Advantage. And then here you can filter by whether it's an HMO, PPO. If you just select all, you're going to see all of them. It's going to sort by price, and the effective year is 2020. We're going to put in client's name here. And then get quote. And again, this is a great feature for if you already know what plan that if you run prescription drugs and you already know and looked up doctors, you already know what plan that you're writing with your client. Or if you're going back and visiting your client, especially now going back to look at some ancillary benefits to add to their plan, you can pull up their plan. So let's just say, for example, you sold them an Anthem 0 premium plan. You can just click on that, it highlights it green, and then you can go up here and click on compare quotes. When you click on compare quotes, you'll see this is the overview of the plan itself and the benefits associated with that. The nice thing about this is, as you're going through the benefits, you can explain to them that you have a $4,900 max out of pocket, annual drug deductible of $60, And then when you get into like emergency care or home health care, inpatient hospital stays and things like that, you can actually show how you can reduce or eliminate those expenses. So if as you're going through and explaining to your client that you have a $350 a day, days 1 through 5, inpatient hospital, if you would like, at the end of the presentation, I can show you how to reduce or eliminate that, that copay that you have, and just trying to get their buy-in as you're going through the benefits. Then you pull up this plan, and then you can click on fill in the gaps. You're going to put in the same information, zip code, age, gender, and then run quote. And as I mentioned in the tool, it does show every plan that is available. So you can see there are, when you do the drop down, there are a bunch of hospital indemnity plans out there. But for example, the Continental Life plan is one of the hospital indemnity plans. You can, whatever you're comfortable with in terms of hospital indemnity, and if you're looking for what carriers to offer, we have several of them that we do offer, and can actually show you the benefits and how to use the hospital indemnity plans. But just say this is an Aetna product, we're going to add this hospital indemnity, and we're actually going to show this side by side to the Anthem Medicare Advantage plan. So now as you're going down through the benefits, you can see, okay, ambulance, with the Anthem plan, there's a $265 copay. If you want, let me back up here. So it's going to show you a base premium of $16.67. So as you add benefits to this plan, then you can actually see what the additional cost would be for that. So the ambulance, $265 if you are taken in the ambulance. With this plan, you can select a $200 occurrence. It would cost you $8.40 per month. Now, most of the time, it's when you're looking at hospital indemnity, it's more of the inpatient copays, the higher copays that individuals are looking to reduce or eliminate. This plan has a cancer benefit as well, so you can add a $2,500, $5,000, or $10,000 lifetime in terms of if they would be diagnosed with cancer, then they would pay that amount lump sum over to them. Office copays for physicians, again, it shows you $5 for primary care, $40 for specialists. You can put in an amount if you want to help offset that. This again is typically not a benefit that a lot of agents would typically add, because it's kind of expensive, $33.17. It does have a max of 20 visits on there, but if you go twice a month, you've already got your money back, because it will pay you the full $30 each time you go. But it is, again, it's $33 per month. But emergency room, same thing. You can it's got a $90 per visit. This plan has a $200 benefit. If you are admitted, then it would pay you the $200 or per $200 each time you're at the emergency room. Again, typically not a benefit, but where we do see the the real benefits is if you're looking to add different things. So like skilled nursing, you can days 1 through 20 are typically paid for as zero, so you don't really need to fill those in. You can, if you want, to receive a benefit, but you can also days 20 through 100, there are copays there, and you can fill in those gaps. And again, it does tell you exactly the amount of the premium it would be for that. But again, it just shows you a side-by-side is how you can reduce or eliminate those additional copays on the Medicare Advantage plan. So as I mentioned, if you're interested, we're more than happy to set up a one-on-one complete walkthrough and show you all the different features you can do. I do want to show you this, though. This is the letterhead I was telling you about. So I like to print that to a PDF, and then you do have to save it, and you can save it with your client's information, and then you will see what this looks like on the letterhead. So let me move this over here. So you can see here, this shows you, it's got your name, your logo, and things like that, you know, on there. And again, you can save this in either print it for your file or save it into your computer as well. So again, if you have any questions regarding that, just let us know. We're happy to go through that with you. The other tool I want to show you is the Medicare Center, and I'll run through that with you as well. Again, under Cornerstone Senior Marketing, go under Medicare Center Online Enrollment Tool. And the website is just medicarecenter.com. So you would just click into that. As I mentioned, if you are ready to sell with any of the carriers and it's through Cornerstone Senior Marketing, you're automatically going to be set up for this tool. And you're automatically going to have an account set up. Your username is always going to be your NPN number, and your password is going to be, it's going to be capital N, capital P, capital N, and then the last 4 digits of your NPN number. And then you would just click login. And then any carrier, it's not going to show all carriers, it's only going to show the carriers that you are set up and ready to sell. So it's not going to show Bright Health, for example, if you're not contracted and ready to sell with Bright Health. This page, what you're looking at is the dashboard. You can see based on, it keeps track of all your activity. So you can see if you've completed any enrollments, it would show you here. In the middle, it's going to show you enrollment by plan type in terms of PDP or Medicare Advantage, and then completed enrollment by plan types as well. This also shows you how many you've actually started, if you partially completed it or if it's fully completed as well. Again, first thing I would like you to do when you get it is go into My Account. This is where you can update your information, and you can put your phone number in, email address, different things like that. If you have a website, there's a URL link that you can actually put on your site, and individual can click into it, they can shop, compare, and they can enroll all on their own, and it would be linked back to you. What I would tell you to do, though, is to click the copy button, and then you can paste it to wherever you're looking to. Don't just highlight and do this, because when you click copy, it's actually, I think, a little bit longer than that. So it won't be fully functional if you just highlight and right click and copy that. So just click the copy button for that, and that's how you would create your link. Let me go back to the dashboard here. So bear with me 1 second here. So going back to the dashboard here, you can also put in notes and also tasks. And anytime you put a task in, so just say, for example, you did an enrollment, or you emailed a link to a client to do the enrollment, you could put a note in here to follow up as a reminder to you, you know, a day later or 2 days later, did the individual complete the enrollment? And that's where these tasks would show. So as I mentioned, it's kind of like a mini CRM built in, and it keeps track of all your notes and everything that you put in there. You can also search profiles. So as you do more and more clients within the system here, all the information is going to be saved. You can just type in either the first, the last name, you know, any of the information here, click search, and then it will pull up your client information. So here's where I did a test client. It was last updated earlier today, and then if they actually enrolled into a plan, you would be able to see the copy of the application out here as well. And there's confirmation numbers to show that they actually have enrolled as well. And you can export this into a Excel spreadsheet as well. The next one is Start Consultation. This is what I recommend everyone use. This is where you can go just exactly like Medicare.gov. You can go in, you can put the client's information, you can put their prescription drugs. You can also check on hospitals and doctors, and you know, it'll pull up plans based on that information. If you already know what plan that they want to enroll in, you can click just Start New Enrollment, and you can just pick the plan and do the enrollment. as well. Let's click on Start Consultation. Here, you're just going to put in the client's information, their date of birth, zip code, and it's going to ask you to check which county, and then that's all it's required to run the quotes. I highly encourage you, again, because this is your system. If you have the other information, email address, their regular address, Medicare ID number, their Part A, Part B effective date, this information is going to save you time when you're doing the online application. Once this information is complete, then you can click Continue. Here is where you would do the scope of appointment. And the way the scope of appointment works is you would type in an email address here, click Email Scope of Appointment. This would then be emailed over to your prospective client. And what they would do is they would click into the scope of appointment, and they would complete the information and then submit it back to you. Once it's submitted back to you, you'll see the activity under this file name, and then this is where you can you click into it. You would put your agent information in, and then submit, and then it's completed. You don't need to do anything else with it, and its scope of appointment is done. And you don't have to do the scope of appointment if you're doing a generic one on your own or a paper scope. Then you can just bypass that and click the tab on health. So again, this is pulling information off the first page when we put in the profile. So you have the zip code. It's going to default because this person, based on the birth date, is 65, and then nothing else to do here. Then you can click Continue. And one thing I will mention as well, so you'll see up here this Add Notes / Task to an Active Profile. On any of these pages, you can click on the plus button, and you can add any of your additional notes that you want to put in there. If you want to list doctors' names that you talked about, you can put that in there. You can also put in a reminder to follow up with an individual a day or 2 days later, or a month later, whatever you want to put in there as a reminder. Here they're asking for extra help. You can, you can skip over it. You don't have to complete it. It's not required. But if you're either uncertain or let's just say they're not eligible, we're going to click Continue. Here's where you would enter your prescription drugs, and as you type, you can just see, just like Medicare.gov, the prescriptions will pop up. You just select it. And then this is obviously there's a generic equivalent. You can either use the brand name or you can use a generic drug. We'll click Use Generic Drug. You put in the milligrams and the quantity, and then you just hit Add Drug. And then again, you can keep adding drugs and to complete the list. And then once everything is completed, then you just click on Drug List is Complete. And again, as I mentioned, you will have access to this anytime by searching that individual's profile. And this information would be saved, so next year when you're meeting with your client, you can see the prescription drugs that they're taking, and all you would have to do is update, adding in new prescriptions, delete any prescriptions that are no longer taken, update the dosage, and you're good to go. You don't have to start over from scratch. Here, it allows you to pick a pharmacy that they're using. Now, this is where it's different a little bit. On Medicare.gov, you can select up to 2 pharmacies. With this tool, you can only select 1, but let's just say they use the CVS pharmacy. If you try to click a second pharmacy, it's going to erase the first click and put it on the second one. Then click Continue. And then here, again, it's only going to show you the plans that you are showing ready to sell. And if you have, again, I've mentioned all the major carriers that we have. If those are set up through Cornerstone or through Integrity, then all those plans will show. If they're not showing, then you just let us know, and we just need to make sure that you are ready to sell, and we can work with the carrier to make sure that gets added. But for this purpose, I'm only showing Medigold and Aetna as certified. But again, it's as you go through, you can see which showing least expensive to the most expensive, and it shows you the annual estimated cost that you'd be paying. But let's just say, for example, it's the Aetna we want to take a look at. We can click view details. We also have the option, we can click send quote, and we can email that quote to the individual. We can actually click enroll and enroll the individual as well, or we can click on check to compare. You can compare up to 3 different plans, and you can see side-by-side comparison. If you view details of the plan, this will show you the premium. It shows you the estimated medical cost, the drug cost, and then you can click when you say show estimate by month or estimated cost by month. You can click into those, and it will show you the chart each month by month, approximately what it would be. And this is the same function you can do on Medicare.gov. You can also look physician directory to look up doctors and hospitals at this point. You can also search pharmacy directory if CVS is not one. It's showing it is an in-network pharmacy. If it was not an in-network pharmacy, you can click here and you can search other pharmacies, or if you just want to search other pharmacies anyway, just click in there. And then you can see the details of the plan. Shows the summary of benefits here, their formulary, information on prior authorization for certain pre-approval required for certain procedures, step therapy information. It's got star ratings. It's got all the information that you would need out here. And then if an individual, again, you can email the quote by clicking send quote, or you can click and enroll. When you click enroll, it shows you the plan, the premium, and then for this plan, it shows you the optional. You can add a dental plan, or you can add a dental vision if you would like to add those on. For this, we're not going to. We're just going to click enroll. Now it's going to be directed to the carrier's form to complete the enrollment. Click next. And then here is where you would just go through each tab and complete the online application. So here, this is the special enrollment. This is where you check the qualifying period. So we check, I'm new to Medicare since they just turned 65. This is the effective date, earliest effective date you could get. And then again, as I mentioned earlier, the more information you put in the client profile, all that information would be populated here. So it's less work you'd have to do down the road. And then it's literally just going through screen by screen. You can see there's 5 additional tabs here. Once you, or 4 additional tabs, then you click submit, and then you are done. And then, as I mentioned, when you go back to the search function of the, when you go back to the search profiles, this is where you can pull up your client's information. And then if you did actually enroll them, this is where you can actually see a copy of the application for your records. This wouldn't say enroll history. This would actually just say enrollment or the app. This is the one we just did, test client 1. And then again, it saves all the information. So if you are looking for specific training, we would love the opportunity to sit with you one-on-one to actually go through and actually let you play around with the tool as well. We find that doing a face-to-face or one-on-one training is most beneficial. Once an agent starts with this, we have seen the adoptability has just been huge, especially on PDPs. When this past open enrollment, we saw a lot of PDP disruption. We saw thousands of enrollments, agents using for PDP enrollments alone. So instead of taking the time to meet with somebody face-to-face, you can do it over the phone. You can send them the link, and they can do the enrollment. The enrollment is very simple. You'll have most of the information in there. They would just need to answer a few questions and then click submit, and then they would be done. But it is 4 o'clock. I appreciate your time. I do not want to go over, and that if there's any questions, please let us know. As I mentioned, please reach out to either your sales director or a service rep, and we're happy to set up a one-on-one training with any of these tools, or really just the opportunity to talk with you in terms of what are you looking to do for marketing, so we can help put together a marketing plan using some of our tools, our co-op dollars, and help you grow your business. So again, thank you very much for attending, and look forward to speaking with you soon.